Hi, yes, it's Paul Liano here, Principal Dentist from Tangmere Dental Care near Chichester. I'm doing a series of tests in relation to aerosol mitigation to try and avoid the extraction method. I've actually done some other videos already because I do have an extraction system which instead of just pumping the air outside, it goes through a heat exchanger and filters so as to not waste the heat. But I mean, even with this system in the ceiling there, I know that in the winter it gets rather cold. So I'm sort of thinking there are other alternatives and the LEV system where it goes along the catch it, kill it, bin it sort of saying where we can actually draw the aerosol away from point of production seems to make the most sense. Now I have tested the vac station, a LEV from China, but I just wasn't impressed in relation to the build quality and the fact that the filters seem to be a bit suspect in terms of whether they'd seal. And of course, if it's going to go through filters, any contagions need to be caught in those filters rather than just sort of going around the sides of soggy cardboard. This unit is made by BOFA. It's called the Dental Aerosol Pro, supplied, I believe, by Dental Directory. It's a beast. It's actually huge. It weighs 54 kilos, this thing. I have managed to sort of position it in by the side of the chair here. I struggled for a while to get positioning at all to do the tests. It's a little bit more challenging because of the rigid arms that it's got here, and it does seem to have a little bit of a droop problem as well. It slowly settles even though I've tried to tighten up these hinges as much as possible. Anyway, so what we're going to do then is get on with the aerosol test using vapesmoke as a visible measurable aerosol. So we've got the particulate meter here showing very nice, very good air quality. So onward with the tests. Right. Okay, Susie, come on in. Okay, settle yourself in there and shuffle yourself on. That's great. Let's just check that's all okay. Right, let's turn this on. Right, as you can hear, it's fairly loud. So I'm going to position this up. Right. As I said, it's got a little bit of a droop problem. I'm going to try and tighten those nuts up a little bit. Got to make sure that this is at a distance where I could work. Let's just see. No. See, I can't get the handpiece under there. Just about get a handpiece into this position, so you know, that's a little bit challenging in terms of the positioning here. Moving it across reasonably easy because I can swing that in and out like so. Yeah. In reality, it does have to go a little bit further away, but it's got such powerful suction. I don't suppose it matters too much in terms of the aerosol. It's just that you would actually be deaf after just a few days, I think, of using this thing. Right, okay, so Susie, off we go. It's going to be 5 breaths to try and bypass this, try for failure. And then it'll be 5 normal breaths. when Susie blew past forwards and up, because there's no shield, of course that was able to bypass this, even though the suction is massive. There we go. See, that has gone down again very quickly, as is the case with all of these LEVs. Let's move some air around. Yeah, no, even moving the air around from behind the chair and up under the chair hasn't caused the spike. I'm just going to turn this down because it's so incredibly noisy. Okay, well, we can hear ourselves now. That's on minimum. So anyway, I mean, obviously, even though the values did go up when Susie managed to blow up past the actual capture hood here, you know, the levels have come back down to normal very, very quickly, much quicker than any other mitigating feature like the open window or the extraction. Which were very similar in terms of the fact that there's a fixed point of ventilation at some other point in the room, and of course that's going to be dragging the air over towards that point, so if there was any infected aerosol, then of course that's actually going to be contaminating the rest of the room and would require the full clean down. To my mind, you know, local catch it, kill it, bin it, any of these LEVs is going to be better than chucking all of the warmed air outside. Anyway, so we're going to be doing the normal breaths now with just 5 breaths straight up, and then we'll do the other one with moving the head to the side, 3 breaths to the left, mainly breathing out through the nose and a little bit through the mouth to simulate normal breathing, because obviously the patient isn't going to be trying to force the air past this hood most of the time. Okay, so we'll do that next. I'll turn that back up. Right, okay, so 5 normal breaths straight up. Little bit of escape there. Particular readings just a little bit going up, so I'll start the timer. Yeah, so we have had a little bit of bleed from this. Not really blowing, but did manage to get past, even though this is on full power. Okay, again, the readings are returned back to normal very quickly within 30 seconds there, actually. So we'll carry on and we'll do the 2 tests to the side now. So 3 breaths one way, 3 breaths the other way, please, Susie. Oh, let's reset that. Well, a little bit of movement there. I suppose that was a bit unfair because that is actually wafting it up this way. can see one of the logistics issues with this unit, even though I've tightened this up as far as I can. This is now down almost resting on the patient's chest, which I'm not sure if people would like that, maybe bringing it closer, but the unit is just so big, it makes it very, very unwieldy, and this group issue is a bit of a problem with the logistics.